Hi, welcome back to my YouTube channel. It has been so long since I have recorded anything, and it's been, I don't know how long, more than 2 3 years, 4 years, or not too sure how long, but it's been too long. Okay, and as you can see, we did a little bit of a rebranding with the name. So initially, if you're new here, it was Convos with Thelma, which was great because there wasn't anything specific we were talking about, and not that we will be talking about one specific thing here, but it is a new year. It is 2026. We are rebranding, hopefully, and we continue to grow. So we have rebranded our name, and it is Medicine Unfiltered. Okay, so hi everyone, welcome to Medicine Unfiltered with Thelma. Well, if you're new here, again, I am Dr. Bonsu. I am an internal medicine third-year medical resident. Can you imagine? I think the last time I was here, I was not even a resident yet. I had a match, or was getting into the match, and now I've gone through intern year, second year, and I'm a third-year resident, and I have about 6 months to go. Okay, so it's been a long journey. I have waited for this to come. It's been so long. We're excited. We graduate in June, God willing. But like I said, if you're new here, I am Dr. Bonsu, but our rebranding is just going to be Medicine Unfiltered with Thelma, or Dr. B. You can call me Dr. B if you prefer, rightfully so, totally fine. So as tradition, or as social media will take it, every new year, everyone gets to do new year resolutions. I'm going to stay healthy, I'm going to start exercising, I'm going to lose weight, summer body, winter body. We're going to make the best use of the winter whilst we're indoors, winter depression. So everyone is working out the beginning of the year. We are into it, we are dieting, we are doing dry January, water fast, whatever you can think of, okay? But we forget about the holistic portion of all of these things. And any kind of movement works, okay? Any kind of dieting is beneficial. Anything that would help in a sense of how much you're eating, how you're moving your body, in a grand scheme of things, it would help in one way or the other. But let's not focus so much on the body we are getting as much as the benefit or the health benefit that it comes with. So today what we are talking about is the physical activity, as well as the lifestyle modification that you hear about, especially when you go to see your doctor. Every time you go to see your doctor, you have a headache, you're having some belly pain, you're having flu-like symptoms. You're like, go home, drink enough water, exercise, rest, sleep. When you feel like you're putting on weight and you feel like you're even a little bit moody, depressed, you like exercise, eat right. So a lot of lifestyle modification come into play when we are counseling patients, and when we're counseling another person on what to do moving forward, especially if it does not necessarily require medication. And when anyone comes into the clinic and we see that their blood pressures are mildly even elevated, where they're going into the stage 1 hypertension, if they're pre-diabetic, the first thing that we recommend everyone should, as we should, is lifestyle modification. Eat good, exercise, make sure you're resting, drinking enough water, but exercise and diet is a big portion. So today we are talking really about that lifestyle modification. According to the USPSTF, which is United States USPS Preventive Service Task Force, United States Preventive Service Task Force, the USPSTF, they are kind of the body that helps us with the recommendations that we need to give to the general public as to what to do regarding cancer screening and most things anyway. So according to the USPSTF, the physical activity they recommend is is 150 minutes of low intensity exercise. And low intensity exercise could be brisk walking, any kind of walking. So according to them, 150 minutes per week of low intensity exercise is the recommendation to continue to keep healthy. Obviously, when you age, or as you age, you start to lose muscle mass, so we recommend that you add some strength training to it. If you're doing some high intensity, moderate intensity, like biking, a lot of running, then they do recommend about 75 minutes of moderate to high intensity with that a week. And with that being said, you could include about 2 days of your workout being strength training. Any kind of strength training is going to help with muscle. So that is their recommendation. So as you are engaging in your physical activity, please take note of this. You can do more, but as you do more, you kind of go into a caloric deficit. So you want to make sure that your calories that you're taking is kind of matching that. So a big portion of what we like to achieve, the summer body, the weight loss, as we start the new year, is really diet. We want you to exercise, which is great. The more you do, the more beneficial cardiovascular benefit, the weight loss benefit, like diabetic or glucose control benefit. So physical exercise is amazing, and you should move your body. I am starting to move my body this year. I didn't really make any big New Year resolution. I wanted to just move regardless of whatever it is, whether it is walking, running, doing dancing. I just wanted to move because I'm either going from work to the couch, work to the couch, work to the couch, or if I'm doing things around the house. I'm not doing any strenuous activity that is making my heart race. So that is a big portion for me, if you would like to say, a New Year resolution. But a big portion of all of that in our weight loss and staying healthy, making sure our lipids, our cholesterol, our blood pressures, our glucose control, everything is taken care of, is diet. There are different types of diets that people have done that have seen great benefits. You've heard of the ketogenic diet, which is more like protein, no carb diet. You've heard of the DASH diet, that is more of a hypertensive diet, low sodium diet. You've also heard of the Mediterranean diet, which seems to be more of a balanced diet. So the USPSTF really recommends the Mediterranean diet, or that's where you see most of the recommendations around Mediterranean diet. A little bit of carbs, a little bit of protein, a little more proteins than carbs, some fruits, some vegetables. Most of this is really lipid control, and a big portion of most of the things that we eat has cholesterol and fats. They are all good. You need fats for energy, for your brain, and all of those things. But you want to limit the saturated fats. Saturated fats should be less than 10% of your food intake, and that's whole milk, the butter, the the fat in meat, cheese, anything that becomes solid at room temperature is considered saturated fats. It's basically saturated fats. And I did not even know too much about this, but palm oil I knew has some saturated fat, but one thing that surprised me in my research was coconut oil. Coconut oil is great, fragrant, good for your food, but it has more saturated fat than, the vegetable oil, the corn oil, the olive oil. So if you've seen a lot of these lifestyle moderators or lifestyle coaches, they talk a lot about olive oil, which is great. The corn oil is good, but a lot of people are hesitant because of the pesticides that are used in these corns or in the cornfields. You don't know what is actually in the corn that is that the oil is being produced from, and that's why most people are quite hesitant. But two big oils are palm oil and coconut oil, and the coconut oil was more the surprising thing for me. I do use palm oil a lot, and if you're Ghanaian, we do use palm oil in our okra, in our soups, well, we get palm oil from our soups, palm nut oil, but so I'm not saying stop eating that, but you want to limit those kind of things, okay? So that's a big portion of our cardiovascular health. One thing that I would encourage you to do, as a young adult, as an adult, when you go to see your PCP, ask them to check your cholesterol levels or your lipid panel. You do have the HDLC and the LDLC, you have your triglycerides, but all of these are really calculations based off of how much of these particles are in your vessels or in your blood. One thing you would want for them to, or you can ask them about, is ApoB, which is the most atherogenic particle that constitutes, plaque buildup. So ApoB elevation is what most people, or the lipid clinics or some heart doctors, are really using to see how much of a lowering effect your cholesterol medication is having an impact. Okay, so ApoB, one jam that you want to take away, ask your physicians to check your ApoB with your lipid panel so that they can make the right decision, because sometimes your lipid levels could be low and your ApoB could also be low, but your LP little a, which is another thing, you wouldn't go into it, could be a little bit high, which means there is some genetic component, then they can work some things out. But anyways, that's just a little bit of a nugget that you want to take away to your primary care physician. Okay, so in what we've talked about, exercise, watching your saturated fats.